Hey everyone, I'm Dr. Willardsen, and today we're going to go through some more cases and talk about the importance of the restoration of a person's mouth. So kind of go through a timeline of occurrences that kind of I see pretty frequently, patterns that patients go through. Maybe they'll have a root canal on a molar, and then over time maybe that tooth has to be removed or extracted, and that starts this domino effect. So we lose one tooth and that changes, and I've talked about this quite a bit, it changes the biomechanics or the way that the mouth functions. And this is a classic example of a case like this, where the patient has had every possible dental procedure done in their mouth. As you can see, there's crowns. She was wearing a partial, which ultimately she stopped wearing because it was uncomfortable. And the partial actually caused the fracture or the removal of 2 additional teeth. So my point with that is we do the best we can to replace the teeth, but anything that's removable or puts unnatural forces on the remaining teeth eventually is going to cause the breakdown of those teeth. So we here at Trustimplants want to stop that process. We want to stop the process of the breakdown of the mouth. And we always have to go back to the alignment and the biomechanics. How is it functioning together? Is there more pressure in the front teeth? And usually patients lose their back teeth first. And unfortunately, it's just out of just not knowing, but they think, well, you can't see it, so go ahead and pull the tooth out. But our molars and our back teeth are really, all of our teeth are very important, but the molars are super important because that's where all of the mastication or the chewing occurs. And also it provides lip support, it provides, facial support. And so just losing one tooth is the beginning of a domino effect. So let's take a look at this case. So this patient is missing all of her molars on the upper and the lower. She's maintained her front teeth, but you can see these crowns. You notice that dark black discoloration around the margin where the crown and the gum meet. That generally is decay or bacteria that's kind of made its way underneath the crown. And so those crowns need to be removed in order to get down to sound, solid tooth structure so that we can get this patient back to harmony. So that restores the natural teeth, but what about the teeth that are missing? So in this case, we had to do extensive bone grafting in order to regenerate the bone, in order to put in implants in the back of the jaw to support the teeth that were missing in the back of the jaw. But once the implants are in place, that acts as an anchor so that I can attach the newly fabricated teeth to those implants. So take a look here and notice they're, on these lowers, they're kind of rotated and discolored, and there's soft tissue discrepancies, meaning the gum tissue is kind of pulled away from the teeth. And all of this is caused by the fact that biomechanically the alignment is totally off. These teeth are struggling, they're fighting, they're trying to stay in the mouth, but they're taking on too much load. And so if we can redistribute that load and get the pressure in the back of the jaw, it's going to take all the pressure off these delicate front teeth. Because our front teeth are a lot more delicate, not just the soft tissue in the teeth themselves, but the bone. Everything in the front area of the upper and lower jaw is more delicate than in the back of the jaw. And so asking the front teeth to take on such a heavy load is a lot to ask of them. They did a pretty good job. They managed like this for many, many years, but it's to the point where it's really starting to break down. So let's take a look here. So this is the before, obviously, photo. And we'll take a look at the after. I won't go into all of the details on how we got to this, but you can see now harmony is restored. When she chews here or here, it's the same. And we've taken the pressure off of these front teeth, which is, once I was able to do that, I felt a lot more better about maintaining those teeth because the load is off of it. So I know that they're going to last this patient for the rest of their life. And by restoring the harmony, by giving them balance on both sides of the jaw so that when they chew, there's good balance and support on both sides. I mean, you can imagine if you were just chewing on one tooth constantly and that pressure, eventually something's going to break. Now, if I redistribute that load throughout the arch, both on the top and the bottom, now all of a sudden it's a much softer, balanced situation. So, this case it's a wonderful case because it really has everything in it. In fact, not just prosthetically, but surgically. I had to do a lot of additional surgical procedures. I mean, I really had to do everything to this patient that I do. But in the end, you can see we were able to accomplish our goal, restore the aesthetics so it looks beautiful, and restore the function, which is more important. Imagine if I did not replace these molars and we just made these front teeth look really, really good. I'm not really doing the patient much of a service. I'm actually kind of doing a disservice because I'm spending money on a situation that will not last long term. Even if I were to do all of this and make a partial or replace those back teeth with a partial, really a partial is just the beginning of losing teeth because it puts a lot of force, unnatural forces on the teeth that are trying to hold this all together. And so this is a great case because you can really see how we just brought everything together and it really restored her facial aesthetics and more importantly, the functionality of her mouth. So my advice to those who are missing even one tooth, get it replaced and take that, make it a priority. I know that a lot of times you think, oh, it's just one tooth, but it really needs to be a priority so that we can avoid these kind of situations in the future. And with good oral hygiene and restoration of the biomechanics and how your mouth works will truly save you so much time, effort, energy, and money over the years. So my advice, if you're missing one tooth, or certainly if you're missing multiple teeth or all of your teeth, get that restored. Restore your mouth to proper balance and biomechanics. I'm Dr. Willardsen, and thanks for watching.